It's truth time. Did you know that the number one health risk to women is actually not breast cancer? It's cardiovascular disease. It's heart health. The number one of women is a heart attack. So let's talk about the risk factors and what you can possibly do about it so that we can decrease your risk of you having a heart attack. So the risk factors we know are high blood pressure, high cholesterol, diabetes, obesity, family history. Those we do know. So let's talk about things we can control. Sometimes family histories, obviously we can't control family history, but there are things we can do for the others. High cholesterol. You want to get your cholesterol checked on a regular basis. You want to make sure if those numbers start creeping up, which they do when we are in menopause and postmenopause, we want to make sure we keep that in check and keep them lower and make changes before it gets out of control. Blood pressure. We want to keep an eye on our blood pressure. And going to our family doctor every year or every 2 years is not enough. We need to know what our blood pressure is doing on a regular basis. Shoppers Drug Mart or a drugstore, Rexall, wherever you are in the world, go to your drugstore, grab a blood pressure machine. Take your blood pressure at home. Usually 3 readings would be good because the first reading is always going to be high because you're like, usually do about 3 readings is perfect. Or you can grab yourself a watch, a smart watch that does blood pressure. This is a Samsung. I calibrate mine to the machines at the hospital, but you calibrate it to it so that it's accurate, right? It gives you an idea of where you're at. It's better than not knowing where your blood pressure is and just assuming it's fine. Because sometimes our blood pressure is slowly creeping up. Our body is adjusting to that, and we don't know that that's happening. So we want to keep on top of it. Am I saying take your blood pressure every day? No, but let's take it on a little more regular basis than 1 year every 2 years. Because again, if you had to go onto blood pressure medications to get your blood pressure down, let's do that. Let's decrease your risk of having a stroke and heart attack. Please, knowledge is power. When you know, you're going to do something about it. So blood pressure. Diabetes. We are going to keep our diabetes in check if you're type 1 or type 2. You want to go to your endocrinologist or your family doctor every 3 months, get your hemoglobin A1C checked. That number will give us an idea of where you are in terms of how your blood sugars are being controlled. And then adjust medications accordingly, whether you're insulin, metformin, whatever medication you're on, we'll adjust it accordingly. Little caveat here with hemoglobin A1C. That number is a bell curve. So it takes an average of what your sugars have been doing over 3 months prior to, with the highest concentration being the month before. That's your bell curve. So it's going to take the average and be right in the middle of your blood sugar numbers. So keep that in mind. So if you want to know what your blood sugar is doing on a more regular basis to see if you need adjustments, you're going to get yourself a continuous sensing monitor like a Dexcom G7 or a Libre. Those you can wear on your arm or your thigh. You can wear that for a couple of weeks and it's going to tell you every day, give you a graph of what's happening with your sugars so you can see and make those adjustments appropriately. Knowledge is power, right? If your weight, you're kind of worried about your weight and that being a factor in increasing your risk of heart disease, there are options for you. Certainly, we look at lifestyle, we look at nutrition, but we also look at whether or not you have a metabolic issue, though you can't lose the weight like menopause and postmenopause and perimenopause. Then a GLP-1 certainly could be an option for you. And I know some people are like, oh, are you telling me to take a GLP-1? No, I'm not. All I'm doing is educating you on what's out there to help you so that you can decrease your risk, because that's what we want. We want you to decrease your risk so you don't have a heart attack. And again, all of this is advice. It is not replacing any physician or nurse practitioner. It is simply education because I want you to go in being informed. Whenever you go to a doctor's appointment, I want you to be informed so that you can go in and ask the right questions so you can get what you need so you can be healthy. And we want to keep our health in check. We want to keep on top of it so that we can do something about it before it becomes catastrophic. I hope that helps. We'll see you next time.